Well, it's almost 2 months since the Liberian-American-born Patrick Sawyer was brought into the consultant hospital here in Lagos and was diagnosed with the Ebola virus disease. In first consultant alone, 2 doctors and 2 nurses who had primary contact with Sawyer have died. But the Lagos State Governor, who came visiting the hospital today, brought some words of encouragement to the management and staff of the hospital.
He told them that the state will assist the hospital to replace all the equipment that were destroyed during the decontamination of the hospital. Now, the Chief Medical Director of the hospital, Dr. Benjamin Ohieri, once again reaffirmed that the hospital is fully decontaminated and ready to do what it knows how to do best, which is caring for the health of the people.
That we can guess about assisting you is to help first replace all of the equipment that we have had to do away with during the decontamination process. I think that's the first thing. Hospital management and patient care is not just a professional calling, it's also a business, and the business must have its tools. So I think the first thing is the tools, because the most important tools, as you rightly mentioned, are the people, personnel, and all of that. That will come as we go forward. Lessons to be learned is that people can now see that, like every infectious disease, is not an automatic death sentence. And we have not seen the last of infectious diseases in the world. One just broke out in the US last week, and they are still looking for a cure, and people are hospitalized. It's been with us for forever. But in terms of institutional support also, there's legislation on the Lagos State Public Health Law, and you were within rights to have done what you did. We are already considering further amendments to that law, and when the executive bill does go to Parliament in a couple of weeks, I expect, because I've asked them to list it for consideration, see what we can tweak there to strengthen capacity going forward. I hope that you will participate at some point during the public hearings that will go on in Parliament. So I think going forward, these are the initial first steps. Things will emerge that would suggest to you that, look, if you got help here, if you got help there, things can be a little more comfortable. And whenever those things do emerge, let the ministry know, and I will be in the know, and we will openly share.